Hey, welcome back. Dr. Peterson's Morning Minute. This is episode number 2. We've been talking about diabetes, and today we're going to talk about, well, what are the implications of having elevated blood sugar? So with diabetes, my cells lack the ability to get the sugar into them. And when they lack that ability, there's two main problems. One is the cell that needs that sugar to function normally doesn't have enough of it, so it doesn't work well. Well, what does that mean? With my energy levels, I'm not gonna have as much strength because I don't have as much sugar in my muscle cells. My nerve cells are not gonna function as well as they normally do because they don't have enough sugar. The rest of my cells in my body, my absorption, my signaling, my hormones, all of that is out of regulation because the cells don't have enough of the energy for them to perform their normal function. The other part of diabetes, we'll call this the silent killer, is diabetes changes the walls of our arteries. And it changes the walls of the big arteries and also the walls of the small arteries. And in doing so, this causes damage and leads to atherosclerosis, which is a buildup of plaque in the arteries. The problem with this is as this plaque builds up, it starts to block blood flow. And if you block blood flow to my heart, I get a heart attack. You block blood flow to my brain, I get a stroke. You block blood flow to the kidneys and the filtration system of the kidneys, I get kidney failure. So those are the major complications that we worry about from diabetes from what we call a macrovascular perspective, or the large blood vessel. There's also microvascular impacts, and this would be sort of the impact of the elevated blood sugar on the smaller blood vessels, for example, in the glomerulus of the kidney, and also the impact in terms of the nervous system. Lack of blood flow, lack of proper sugar in the nerve cells leads to conditions like peripheral neuropathy. The small blood vessels, that also impacts our feet, and we oftentimes see people with peripheral vascular disease associated with diabetes, and this can sometimes lead to amputations. So really with diabetes, the problem is not enough sugar in the cells that need it, and too much in the bloodstream, leading to blockage of those arteries, leading to major complications. I look forward to seeing you for our next minute. Take care.